Hey everyone, welcome to my channel. I am Doyle Nagwani and I am a third year biomedical engineering student at NIT Raipur, and today we are diving into the fascinating world of artificial intelligence through the lens of healthcare. We will explore the first 4 chapters of the book named Artificial Intelligence, a Modern Approach by Stuart J. Peter Norvig. I promise this will be exciting. From diagnosing diseases to robotic surgeries, AI is revolutionizing how we approach medicine. So grab a snack, get comfortable, and let's get started. Let's kick things off by answering the big question: what is AI? At its core, artificial intelligence is about creating systems that can perform tasks that would normally require human intelligence. Think of AI as your digital assistants, like a chatbot that can help with medical queries or system that analyzes your health data to suggest preventive measures. AI has different approaches, including think humanly. This aims to mimic human thought processes. For instance, using cognitive models that replicate how a doctor thinks while diagnosing. Acting humanly. This focuses on how AI behaves. For example, AI chatbots that provide patient care by answering health-related questions. Thinking rationally. Here, AI focuses on making logical decisions. For example, an AI that determines the best treatment plan based on evidence and outcomes. Lastly, acting rationally. This is about taking actions that maximize the likelihood of achieving a specific goal. Imagine a surgical robot that adjusts its action in real time to ensure the best surgical outcome. Also, in the medical field, the Turing test is the most essential because it assesses whether a machine can exhibit human-like intelligence. Imagine if an AI system could interact with patients so seamlessly that they wouldn't know it's not a human. How cool would be that? Now, let's explore intelligent agents. An agent is a system that perceives its environments and acts to achieve its goal. In healthcare, think about a robotic surgical assistant that uses sensors to understand the surgical environment and assist surgeons in real time. There are different types of agents. First, simple reflex agent. This acts on the current percepts without considering the future. For instance, an alarms that goes off when a patient's vital drop below a safe threshold. Model-based reflex agents. This remember past actions and states. A glucose monitor that adjusts insulin doses based on the previous readings. Now, third, the goal-based agents. This aims for specific objectives. Consider an AI that helps in planning treatments for chronic illnesses by analyzing patient data to recommend the most effective therapies. Utility-based agents. This thrive to maximize a utility function. An AI system that chooses treatment plans based on patient outcomes and side effects exemplifies this. The future of healthcare is heavily reliant on these intelligent agents to assist in patient care, making it more efficient and accurate. Now, let's get into how AI solves problems, and it all revolves around searching. A search algorithm explores possible solutions and finds the best one. Picture an AI that needs to diagnose a patient based on various symptoms. It navigates through a vast state space of possible medical conditions to find the best match. There are basically 2 types of searches: uninformed search and the informed search. In uninformed search is basically the blind search. This approach does not utilize any domain specific knowledge and checks every possible solutions. It's like going to a huge library and looking through every book to find the information you need without a catalog. For example, an AI that randomly checks potential diagnosis based on symptoms without knowing which are the most common. Now, secondly, informed search. It is basically the heuristic based searches. Heuristics means hints or previous knowledge, anything that the agent must have any knowledge related to anything that agents want to predict. This method utilizes domain knowledge to find solution more efficiently in healthcare, and AI might use patient data to prioritize the most likely conditions based on the symptoms presented. So there are many search strategies also, like which strategy should the AI agent follow. So I will cover only three types. There is breadth first search, known as BFS. This explores all the possibilities at one level before moving deeper. Imagine it as a doctor checking for common conditions before considering rare diseases. Depth first search. This dives deep into one possibility before exploring others, similar to a doctor investigating a suspected condition in depth. A-star search. This is an informed search algorithm that uses heuristics to find the best path efficiently. An example in healthcare would be an AI that analyzes data from previous patients to recommend the best treatment based on similar cases. Understanding these search techniques is crucial for developing effective AI applications and medicines. AI is not limited to classic search techniques. It can also utilize optimization methods to enhance results. Local search is one such technique, where AI makes incremental changes to improve the current situations. For instance, optimizing the settings of an MRI scan to achieve the clearest image can be thought of as a local search in action. But what happens when AI gets stuck in local optimum? That's where stochastic search comes into play. This approach introduces randomness to explore new options, much like trying different combinations of medications to find the best treatment of a complex disease. By leveraging these advanced searching techniques, AI can provide more accurate diagnostics and treatment options, making it powerful in the medical field. Now let's talk about adversarial search, which is crucial in competitive environments. Think of AI predicting how a virus might mutate. Using the Minimax algorithm, the AI can minimize the worst case scenario of these mutations, focusing on strategies that safeguard patient health. For example, during an outbreak of influenza, the AI evaluates various potential mutations and the effectiveness of vaccines against them. It also utilizes alpha beta pruning to eliminate less promising scenarios, helping researchers to focus on the most concerning mutations. This technique allows healthcare professionals to prepare better for possible outcomes in disease management, ultimately saving lives by creating effective vaccines more quickly. AI often deals with constraint satisfaction problems, to be known as CSP, which involves finding a solution that meets specific constraints. Picture a hospital scheduling surgeries. AI must consider factors like surgeon availability, patient needs, and an operating room time. For example, when hospital has a multiple patients needing surgery, AI can efficiently allocate resources without overbooking or wasting time. When conflicts arise, AI employs backtracking. It undoes decision and tries different combinations until a feasible schedule emerges. This ensures that every patient receives timely care, demonstrating how AI can optimize complex logistical problems in healthcare. The ability to balance multiple constraints efficiently is the key to improving patient outcomes. Now, let's explore logical agents. This system follows strict rules to make decisions. In healthcare, if an AI diagnoses a patient with cough and fever, it applies propositional logic to conclude that they might have the flu. A knowledge-based agent uses a vast database of facts and rules to assist with diagnosis, employing theorem proving to ensure the logical conclusions it reaches are valid. For example, an AI could cross-reference systems with known illness and suggest possible conditions, significantly speeding up the diagnostic process. Now, moving on to the first order logic, to be termed as FOL, which enables AI to handle more complex relationships. FOL allows for the representation of statements that involve objects and their properties. For example, AI can express, for all patients with cough and fever, there exists a treatment. This capability is invaluable for mapping symptoms to diseases and treatments, enhancing the precision of AI-driven medical solutions. Imagine a cancer treatment AI that uses FOL to determine which therapies are effective based on multiple patient factors like age, genetics, and health history. Inferences are there in first order logic. So inference in first order logic help AI draw conclusion from facts. Using unification, the AI can match patterns in data to infer new knowledge. For instance, it can use forward chaining, where it starts with the known facts and applies rules to diagnose a patient. This might look like if a patient has high fever and cough, they likely have the flu, therefore recommend antiviral medication. Alternatively, backward chaining begins with the desired diagnosis and checks if the systems align. These inference methods are crucial in supporting clinical decisions based on existing medical knowledge, allowing healthcare providers to make informed choices quickly. AI also needs to plan for the future, and that's where classical planning comes into the picture. This involves finding a sequence of actions that lead from an initial stage to the goal. Consider an AI that needs to develop a treatment plan for cancer. It has to determine the right order of chemotherapy, surgery, and recovery to ensure the best outcome for the patient. Using state space search, AI evaluates all possible action sequences to find the optimal treatment path. This can also be used in hospital emergency planning, where AI creates action plan for various scenarios, ensuring readiness for any situation. In the real world, AI must consider factors like time and resources. Hierarchical planning allows AI to break down complex tasks into simple, manageable steps. For example, in surgery, the planning might involve pre-operation preparation, the surgery itself, and the post-operation care. Contingent planning enables the AI to prepare for uncertainties, like if a patient's vitals change unexpectedly during surgery. Imagine a robotic surgical assistant that has contingency plans for different possible patient responses during the operation, ensuring flexibility and safety. Knowledge representation is vital for AI to understand the medical world. It uses ontologies to categorize information, defining relationships between diseases, symptoms, and treatments. For example, an AI system can establish that fever is related to infection and antibiotics. Semantic networks visually represent these connections, allowing AI to navigate complex medical data efficiently. This is especially useful in drug discovery, where AI must understand relationships between various compounds and disease to suggest potential new treatments. Also, uncertainty is a big part of healthcare, and AI needs to quantify it effectively. Using Bayesian networks, AI calculates the probability of various diseases based on the patient's symptoms and the history. For example, a patient presenting with symptoms of fatigue and weight loss might have several potential diagnoses. The AI analyzes prior data and applies base rule to update the likelihood of each condition as new results come in. This dynamic approach is crucial for making informed decisions in uncertain situations, allowing doctors to tailor treatments based on real-time probabilities. Probabilistic reasoning allows AI to make educated guesses based on incomplete information. For instance, in managing chronic diseases, AI can use hidden marker models referred as HMMs to predict a patient's health trajectory based on observable symptoms. Consider a patient with diabetes. The AI tracks blood sugar levels, meals, and medication to infer potential future states. By filling the gaps with inference, AI provides insights that helps doctors adjust treatment plans proactively. When doctors make decisions, they weigh the risk and benefits. AI does the same using utility functions. It evaluates which action will provide the highest benefit. For example, an AI system might suggest a treatment with a higher chance of recovery, balancing risk and reward. It could analyze factors like the side effects of medication versus the likelihood of recovery, ensuring the best possible outcome for the patient. When AI has to make decisions over time, it uses Markov decision processes known as MDPs. In treating chronic diseases like diabetes, AI plans future actions based on current blood sugar levels. When it doesn't have all the information, it uses partially observable Markov decision process known as POMDPS. It uses POMDPS to make the best decision with the data it has, helping doctors manage long-term treatments. For example, if a patient's blood sugar levels are fluctuating, AI can recommend adjustments in medication or lifestyle changes based on predicted future states, optimizing care over time. Also, now that's all about the first four chapters of that book, and I have summarized all the key points, key words that I have understood so far from that book. And in conclusion, I would like to say that that's how AI is revolutionizing the medical world, from diagnosing diseases to creating treatment plans and even assisting in surgeries. AI is making healthcare smarter, faster, and better. I hope this dive deep into artificial intelligence, a modern approach by Stuart J, Peter Norvig, has helped you understand just how transformative AI can be in medicine. As I belong to biomedical engineering department, so I have related AI in terms of medicine, medical world, but you are free to relate AI with anything because AI is so vast. If you enjoyed this video, don't forget to subscribe and leave a comment below on what part of AI in healthcare excites you the most. Until next time, stay curious and I will see you in the next video. Thank you.